Is Juliet in the room? Kia ora, Juliet.
Kia ora. I've got a bit of a throat, so I hope you can hear me.
Need some water or anything? You gonna be okay?
I'll just speak slightly lower. I'm Juliet McAra, and I've travelled up from Christchurch, where I have a good friend in his 50s with stage 4 bile duct cancer. He's been given 3 months to 2 years by the oncologist. He's had 7 months since diagnosis, and he's still working full-time in the nursing profession. This man needs help accessing cannabis, and several circles of friends around him have become involved trying to help him. This is what he wants, even though he hasn't been involved in recreational cannabis prior to his diagnosis. New Zealand doesn't have anything else to offer him beyond a small amount of chemo, which he has had. Possibly in Australia, he would get an immunotherapy drug. Anyway, cannabis has been really helpful for his sleep and for pain relief, and he also hopes that if he can have it in high enough doses, that he might slow the cancer down and have a bit more time with his family. There are plenty of anecdotes to show that this can happen in a few cases, so what has he got to lose? The thing that's bothering him is that his friends are at risk of arrest, so this is very stressful for him and his friends. The people who help such patients should be commended, not made criminals. They most especially should not be made criminals when in the next few years this drug could well be legal or decriminalised. A compassionate system would allow growers to grow and processors to process medicine of any type that patients need from this plant until other options are available in years to come. I'd like to suggest that you somehow find a way to have some kind of moratorium on arresting those who supply patients with any illness that benefits from medical cannabis. Not just those with only 1 year left. It's a time of transition, I hope, until we have a Canadian or Israeli or Colorado style setup, picking out the best aspects of all those, of all those that have gone before and trying to avoid their worst mistakes. It beggars belief that police energy should be wasted at this time of transition when real crimes with actual victims are being committed. So please consider a moratorium on prosecution for that wider circle of helpers. Remember, there are no victims, so this does not have to be a crime. Thank you.
Thank you. Any questions, Steve? You're clear. Thank you.
Thanks.
Thank you for caring for your friend.